Prenatal care can start whenever a client is ready to initiate care here, whether that's in the first trimester or later on in pregnancy. What it typically looks like is folks come in for their initial visit, usually around 10 to 12 weeks, and then we go over their whole health history, can collect labs, which we'll talk about in advance, can order a dating ultrasound if that's something the client desires. And then from there, we see them monthly until 28 weeks of pregnancy, and then every 2 weeks until 36 weeks, weekly after that. At all of those visits, there's some intervals where labs are recommended, which we'll talk about in advance. And vitals are always checked at each visit, fetal growth, fetal heart tones, and then there's time for questions, concerns, talking about aches and pains, as well as educational topics that come up that are relevant to either pregnancy, parenting, birth, breastfeeding, so on and so forth. One thing that's different about prenatal visits at Roots is the length of time. The initial visit, or even 2 visits, can be about 60 minutes in length, and there's lots of time for a tour of the space to talk about your concerns, past medical experiences, past birth experiences, what you're personally desiring for your specific birth situation. The subsequent visits are usually 30 to 60 minutes. If there's labs, we usually schedule it for 60 minutes, so there's time. And in that time of 30 minutes, there's a lot of time for education that we have sort of pre-programmed. We have a schedule that we can follow, but if folks are coming with their own questions, we don't have to follow any type of a list of educational topics. Prenatal visits are meant to be helpful to the person who's attending them, and so whatever is actually helpful to them is what we can do. It's very individualized and flexible, and a big piece of midwifery care is that relationship. So we do encourage folks to schedule on different days of the week so they can meet all the midwives, develop that comfortable relationship with whomever might be on call for their birth, and get into sort of the more potentially heavy emotional layers that people might want to discuss at their prenatal care in advance of their birth.